Hi, I'm Dr. T. Karazian, and I want to talk to you about why so many patients suffer from anxiety and nervousness and inability to handle movement and motion, and why they don't get care in the healthcare system that is effective for them. Did you know that 90% of the brain is there to actually inhibit the rest of the brain, the rest of the 10% that's there? So when you look at the brain has two main filtering systems. One is called the basic ganglia, and one is called the cerebellum. So the way our brain works is that our brain is constantly getting input and stimuli from all our different receptors. We have visual receptors and smell receptors and proprioceptors for motion and movement, and we have vestibular receptors in our inner ear to let us know where we are, and we have taste receptors and all these different receptors throughout our body, and they fire to an area of the brain called the thalamus. Now, this is a lot of input to the brain, and if the brain is healthy and doing its job, there's an area of the brain called the basic ganglia that filters this area. However, the basic ganglia is extremely sensitive to inflammation and hypoxia. Now, what happens in inflammation is the inflammatory mediators that turn on neurons in the brain to be inflamed, they shut down what are called mitochondria within the neuron itself, so these neurons lose the ability to function well. And in particular, the basic ganglia is also very sensitive to oxidative stress. So when inflammation takes place, these neurons lose the ability to do their job, and the main function of the basic ganglia is to dampen the thalamus. So when people get neuroinflammation, you see it all the time after someone gets a traumatic brain injury, they can't handle light, they can't handle stimulus, they get restless mind, they have inability to really handle their environment, and they're really living in a miserable world. Now, there's different degrees of neuroinflammation to these pathways. Some people can't handle any stimulus, and some people just end up with restless mind and chronic anxiety and can't fall asleep. But the underlying pathophysiology and mechanism for many people that just feel overstimulated and can't calm down is really due to a neuroinflammatory model. The other pathway in the brain that filters input is called the cerebellum. So the cerebellum is in the back of the brain, and the most constant and ongoing stimulus to the brain is gravity and movement. So as we move and we have gravity to stretch our muscles and muscle spindles and Golgi tendons, these activate inputs to the cerebellum, and there's a lot of input throughout the day that takes place here, and the cerebellum's job is to filter it. Well, the cerebellum is also extremely sensitive to hypoxia and oxidative stress. So in states of inflammation, the pathways in the cerebellum that should dampen all this input become dramatically compromised. And this leads to inability to handle movement, motion, being in crowded places, and many people suffer from these types of environmentally induced anxieties and so forth. So part of the reason why many people that have chronic insomnia, have restless mind, can't sleep, can't function, is because their brain is inflamed. And when the brain is inflamed, the two most vulnerable areas of the brain to inflammation, the basal ganglia and cerebellum, which act as filters, can't do their job. And when they can't do their job, the mind cannot rest. The brain cannot rest. So the brain is always activated, and these patients, out of desperation, try all the different anti-anxiety medications and try to do things to impact the GABA receptors, and maybe even resort to alcohol or drugs just to calm down their brain. But really, the underlying mechanism is neuroinflammation. I've been working with chronic patients for the past 20 years. I've seen many patients that have chronic anxiety and nervousness and insomnia that really have an underlying inflammatory mechanism. In my new course, focused on neuroinflammation, I'm going to teach you exactly how to work through these patients. So when you see a patient that has chronic nervous and anxiety, how do you identify if it's really a neuroinflammatory mechanism or not? And then if it is, what do you do about it? What are each of the steps that are involved? And it's much more complicated than just taking some anti-inflammatories or taking a probiotic. You have to go through all the different pathways that are involved that can increase inflammation. So I'll teach you a step-by-step approach of how I do this in my practice using labs, diet, history, physical examination, and really give you this edge in how to help these patients that are chronically suffering from inability to shut down their mind and lose the ability for their brain to do its job, which is really to inhibit itself. Hope to see you in my neuroinflammation course. I think you'll gain some valuable information to help the patients you'll guarantee to see that suffer from chronic anxiety, nervousness, and inability to handle stimuli. Thank you.